If you have a thyroid problem, then there's a good chance that you are taking other prescription medications. How do I know? Because thyroid problems put you at high risk for developing issues like high blood pressure, high cholesterol, and weight gain. But did you know that the very medications used to treat these problems can actually make your thyroid worse? It's true. And in a vicious cycle, you may be taking medications used to treat the problems caused by your thyroid issue that may circle back and make your thyroid even worse. Today, we're going to go over this list of medications to make sure you aren't taking any and what to do if you are. There are 4 main ways that prescription medications can interfere with thyroid function. And when I talk about thyroid function, I'm using this as a term to describe how well your thyroid is working. These effects can range from mild to severe, which is why many of them may actually slip under your radar. Let's go over these 4 categories so you can better understand what I mean. Category number 1 are medications that impact T4 to T3 conversion. This is the process by which your body takes the inactive T4 thyroid hormone and converts it to the active thyroid hormone known as T3. And since T3 is the strongest and most powerful thyroid hormone that exists, if your body cannot do this, or if its ability to do this is impaired even a little bit, you'll start to experience low thyroid symptoms like weight gain, hair loss, depression, and more. Surprisingly, many medications can cause this very issue, leading to low T3, including some medications that are used to treat common conditions like high blood pressure and depression. The first on this list are medications that fall into the class of beta blockers. This is a class of medications used to treat conditions like high blood pressure, migraines, and even anxiety. And because hypothyroidism leads to high blood pressure, it's very common for patients with this very issue to be taking these very medications. If that's you, make sure you check with your doctor to see if you are taking a beta blocker, because it may be making your thyroid function worse. The good news is that there are many other blood pressure lowering medications available, and switching to one of these is actually pretty easy. But if you want to do something even better, then my recommendation would be to focus on lifestyle changes, because changing your lifestyle can not only improve your thyroid, it can also lower your blood pressure. The next set of prescription medications that do this are narcotics. This includes all types of moderately powerful narcotics such as Vicodin and Percocet, and even those that are stronger. More concerning than this though is the fact that low thyroid function can actually lead to chronic muscle pain as well as fibromyalgia. So you may be taking pain medication to treat pain that is actually related to your thyroid, that will only serve to make your thyroid worse. I know that may sound confusing, but I have personally seen it happen. It's also worth mentioning here that some patients, especially those with Hashimoto's thyroiditis, take a medication called low-dose naltrexone, which may block narcotic function. So if you are taking that medication, keep this all in mind. And by the way, some over-the-counter pain medications like Ibuprofen can actually have a negative effect on your thyroid as well. But if you have to choose between the narcotics or the over-the-counter versions, go with the over-the-counter versions. Next on the list are antidepressants, and this one is huge. How many of you listening to this right now are taking an antidepressant to treat depression and had no idea that this medication may make your thyroid worse? Roughly 24% of American women are taking an antidepressant, and this percentage is even higher among hypothyroid patients because hypothyroidism leads to depression. The best way to solve depression if you have a thyroid problem is not with antidepressants. The best method is to optimize your T3 level. This is exactly why T3 only medications like Cytomel and liothyronine can have an antidepressant effect. It's not that you necessarily have depression, it's that your thyroid is being undertreated. The next 2 on the list include methimazole and PTU. These are both antithyroid medications used to treat hyperthyroidism. So it's no surprise that these medications lower thyroid function. For people who are taking them, that's exactly what they want because they have too much thyroid in their body. The problem here is that some of these patients are actually taking more than they need. And because of this, they can flip from a hyperthyroid state to a hypothyroid state. The next category of medications that we need to discuss are those that block TSH production. And these medications work by interfering with how your brain communicates with your thyroid gland. Most thyroid patients are focused solely on their thyroid gland, which is found in their neck, because that's where most thyroid problems arise. But there are plenty of thyroid patients who have thyroid problems because of their brain and pituitary gland, and not necessarily their thyroid gland. If your brain can't communicate with your thyroid gland, it doesn't matter that that thyroid gland could function otherwise. In this situation, it will never get the message to produce thyroid hormones. As a result, this is an important and often overlooked cause of thyroid problems. And there are many medications which can make this issue even worse. The first on this list are steroids. These are medications that are often given to patients who have high levels of inflammation in their body. Most doctors know not to prescribe these powerful medications long term, but sometimes it may be necessary. These steroids have a suppressive effect on TSH in the pituitary gland, and this suppressive effect gets worse the longer you take them. And by the way, this side effect can also occur with topical steroids as well. This is especially true if you are applying those steroids to some thin skin found on your face. In some situations, you can actually apply enough steroid cream to your face for that steroid to get inside of your body and cause issues with your adrenal glands and your thyroid gland. Next on the list are dopamine agonists. These medications are used to treat Parkinson's disease and they're not commonly prescribed, but I did want to include them here for completeness. And finally, we have one of the most commonly prescribed medications out there, and that's metformin. This medication is commonly prescribed to treat diabetes and insulin resistance, but it's also used off-label to treat things like longevity and even obesity. What's really interesting about metformin is that it was once thought to have a negative effect on the TSH, but more recent research suggests that perhaps metformin has a positive effect on the TSH, not a negative one. In other words, taking metformin may actually improve thyroid function. After looking at this research, I'm of the opinion that this is probably the case. And it may be worth considering, especially if you have Hashimoto's thyroiditis and need a boost to thyroid function. But I am including it here because some of that is up in the air right now. Category number 3 are medications that block thyroid hormone production from the thyroid gland. The medications that we've discussed so far have the potential to impact thyroid conversion as well as your body's ability to produce thyroid hormone from the thyroid gland. But this category is a little bit different. These medications work by damaging the thyroid gland directly, which is more similar to what Hashimoto's thyroiditis does to patients who have it. And if your thyroid gland isn't working, it doesn't matter if your brain is communicating adequately or if your body can activate that thyroid hormone. These medications are not as common as some of the others we've discussed so far, but you should still be aware of them. First on the list is potassium iodide. This is a form of iodine that is used to cleanse the skin and used in dermatologic procedures. Unless you are getting these kind of procedures frequently, it's probably not going to cause a big issue for you. But you should know that high doses of iodine may impact your thyroid's ability to produce thyroid hormone. Another medication in this class is lithium. This one is more common because it's used to treat mood disorders as well as bipolar disorder. The problem is that high doses of lithium, especially if used for a long period of time, can cause permanent thyroid gland damage. For this reason, anyone who is taking lithium must have their thyroid checked regularly. It's worth pointing out here that T3 only thyroid medications like liothyronine and Cytomel have been shown to be very effective at treating bipolar disorder. So if you are someone who is taking lithium to treat bipolar disorder and you haven't tried these therapies, it would be worth looking into them. And third on the list is a cardiac medication called amiodarone. This one isn't very common, and doctors who prescribe it know that they need to keep an eye on thyroid function when a patient is taking it. Category number 4 are prescription medications that block thyroid medication absorption. And this is probably the biggest section out of all we've discussed so far, because just about every single prescription medication has the ability to impact the absorption of thyroid medication if taken incorrectly. This, by the way, is the very reason that you've been instructed to take your thyroid medication on an empty stomach if it's been prescribed to you. While this is true, you should know that some medications cause bigger issues with absorption than others. And it's these that you really need to be aware of. The first on this list are acid blockers and antacids. What's most dangerous about these medications is that they are available over the counter. And as a result, some people get hooked on them and have been taking them for years and years and years. Pretty much any medication that reduces stomach acid will have a negative effect on thyroid hormone medication absorption. And that's because your body needs acid in order to break down nutrients and even thyroid medications in order to absorb them. Unfortunately, because these medications often suppress acid production for hours even after you've taken them, it doesn't matter if you take your thyroid medication hours away from them, they can still cause problems. As a result, the best way to solve this issue is to do your best to get off and to stop taking those acid blockers. Next on the list is fiber. Fiber medications and fiber supplements are commonly used to treat constipation, which is another side effect of having hypothyroidism. And by the way, have you noticed the connection here? Many thyroid patients are taking other prescription medications to treat the symptoms caused by thyroid dysfunction. And in the end, many of these medications only serve to cause more thyroid problems. The real focus and the real message I want you to get is that thyroid hormone optimization is what's needed, not more medication. But back to these fibers for just a second. They work by pushing stool through your GI tract, which helps to alleviate the symptoms of constipation. But this effect accelerates the rate at which your thyroid medication moves through your GI tract and can reduce absorption of it. And by the way, this also applies to fiber that you get from your diet and fibers found in supplements for weight loss like glucomannan. Next on the list is orlistat. This is a medication that blocks the absorption of fat and is sometimes used for weight loss. It's not as commonly used as some of the GLP-1 agonists nowadays, but some people still use it. Next up, we have cholestyramine, which is often used to treat high cholesterol and is considered a binder. Because of its binding capacity, it's also sometimes used to treat diarrhea and even used as a detoxification agent. Next on the list is calcium carbonate. This is used to replace low calcium in the body and is commonly prescribed to patients who have had their thyroid glands removed who have also suffered from parathyroid gland damage. If you are taking calcium of any type, including some calcium found in your diet, you must take your thyroid medication at least 4 hours away from it. Next up is ferrous sulfate, which is a fancy name of saying iron. And this medication is often used to treat low iron as well as anemia. Iron, much like calcium, is also a strong binder of thyroid hormone. So just like calcium, it should be taken 4 hours away from whenever you take your thyroid medication. And last on this list is estrogen, or any product that increases estrogen levels. Estrogen doesn't directly impact thyroid medication absorption, but it does impact how well your body can utilize that medication. It does this because it increases a protein called thyroid binding globulin. And this protein binds to free thyroid hormone. If you increase your thyroid binding globulin levels, then there will be less free thyroid hormone available for the body to use. This isn't necessarily or automatically a problem, but you should be aware if you are taking anything that increases estrogen that you may need to make adjustments to your thyroid medication dose. The moral of the story here is that if you are taking thyroid medication and any other prescription medication, you need to double check what you're taking. You should also be aware that many of the medications you might be taking are used to treat the symptoms associated with hypothyroidism. If you find that you're taking a prescription medication that I've just discussed, your next step should be to talk to your doctor to see if there's an alternative that can be used in its place. For instance, if you are someone who is taking a beta blocker for high blood pressure, then you may want to switch to an ACE inhibitor. The same logic applies if you're taking an antidepressant or a pain medication or whatever. Making these small tweaks to the medications that you're taking can improve your thyroid function by as much as 10 to 20%. And this change can have a huge impact on how you are feeling. But I can also give you some even better advice. If you focus on improving thyroid function, you might find that many of your symptoms like high blood pressure, high cholesterol, hair loss, and weight gain completely vanish. So instead of going to prescription medications first, try lifestyle changes instead. It just so happens that your thyroid is very responsive to these treatments, including things like eating whole foods, regularly exercising, reducing your stress, and even taking certain supplements. If you don't know where to start, then I'd recommend checking out this video next.